De Blasio vowing to take extreme measures to address the crisis which continues to plague Rikers Island.
It is a bad situation that must be addressed very, very aggressively. The key is staffing. We're creating relief by bringing in additional staffing with help from NYPD, private staffing, whatever it takes.
So local congressional leaders are demanding something even more extreme. They want all inmates out of Rikers and the jail shut down immediately. Jan Ransom has been following the Rikers story very closely as an investigative reporter for the New York Times. She joins us this morning to share her perspective on this life and death situation. So Jan, good morning to you. Thanks for being here.
Thank you for having me.
So Jan, I'm curious. I toured Rikers about 4 years ago and people described it as hell on earth. Nothing like it was being described with these leaders. So when was the last time you toured Rikers Island, and what were the conditions like when you visited compared to what's being described?
Right. So the last time I visited Rikers was before the pandemic. However, I didn't actually tour. I went to the visitation center. But even this description that I've got then is far different when I'm hearing now.
Yeah.
Yeah. And Mayor de Blasio, he and many city leaders are blaming what we're seeing at Rikers Island on COVID. But knowing what you know already, weren't they just as bad prior to the pandemic?
Absolutely. I mean, Rikers has had issues for a number of years. Primarily, it's use of force from correction officers, as well as this deep-seated culture of violence. But what you see with COVID is that it created this snowball effect and making, issues that existed before just far more worse.
Yeah, and this is happening on both sides of the cells, right? For inmates, it's a dangerous situation, and it's also a dangerous situation for correction officers. But I want to talk about Ismael Kareem. He was the inmate who died on Sunday, had a history of health issues, right? Can you share some of the details surrounding his death, why he was incarcerated in the first place? From my understanding, he was supposed to be released very soon.
Absolutely. So Mr. Kareem was sent to Rikers on what we call a technical parole violation. And what this is when someone, for example, misses curfew or fails to report to their parole officer. And it was the latter for Mr. Kareem. He had a number of health issues when he was sent to Rikers. He was using a wheelchair. He had hypertension, asthma, diabetes, a history of epilepsy, and psychiatric issues. He was forced to spend a lot of time, 10 days, in intake. And we've been hearing a lot about intake during these discussions around Rikers. And it's just a really awful place for people to be, especially for prolonged periods of time. And he contracted COVID as well.
Yeah. And didn't his partner also say that he might have been stabbed in some sort of an altercation prior to
Exactly. Yeah, that's what we were told preceded his visit to Rikers, that he had been stabbed in some sort of altercation in the street and had checked into a hospital, which is how he was eventually apprehended.
So let's talk about some of the medical things that are happening on Rikers Island, right? New York City Health and Hospital is supporting the healthcare staff at Rikers and 2 new clinics as well. So do you think that would have made a difference in Kareem's case?
It's hard to know what would have made a difference. I mean, at the end of the day, staffing has been a huge issue, this issue of officers not coming in. And, Kareem had been complaining for days about having chest pain. And so I don't know that having 2 additional clinics open would have changed things. I mean, he needed people there to help him. He needed to see a doctor, and he didn't.
Yeah. Speaking of staffing, how realistic do you think it is for the city to bring in private security, which is something they've been talking about?
I think it's to be determined. The unions have made it clear that they intend to fight this tooth and nail. They've said that this is illegal. And in fact, there is a law that says that, any role or job done by a correction officer cannot be privatized. So it'll be interesting to see how the administration gets around that, if they can. I mean, we are in sort of an emergency right now.
Yeah, and I've been speaking to a lot of correction officers who've been reaching out saying, look, the reason why we're calling out sick, yes, we're calling out sick. And we know that that puts a burden on our other correction officers. But we're calling out because we don't feel safe. We don't feel safe going to work because we feel like everybody's turned our back on us for a number of years, which is why your reporting is so important. So with all of that said, right, on both sides of the cell, the closure is a 10-year plan. Do you think it'll happen any sooner?
No, not at all. I mean, we've already seen that it's being delayed. The initial planning was for 2026, and we're seeing that it could be pushed a year or more beyond that.
Right, because you need to have those borough jails ready to go, and they're not ready.
Exactly.
Jan, thank you for staying on top of the story, for your reporting. It's an important issue for so many, and I appreciate you continuing to shed a light on it.
Thank you for having me.